some background noise that is gone. That's great. Good morning, everybody. Good afternoon from diverse places in the world. Very happy to have you here in our session, Digital Health Promises and Challenges towards SDG 3, which is one of the UN one goal, the third one of the United Nations to reach sustainability with focus on health. And we have a great selection of speakers today, starting with Melissa Andrews, Alexandra Pashos, Joseph Abdullah, Ganesh, Jai Ganesh, Stephen Waning, and Beatrice Garrett. They will be all introduced shortly by the panelists, which I would like to welcome to. Short presentation of myself too. My name is Titus Kühne. I'm the director of the Institute for Computer Assisted Medicine at the Charité, the Medical University in Berlin. And I'm very happy to be the coordinator of the session today. And I'm co-chair with Evelyn Akello. And maybe you can say a short hello, Evelyn.
Thank you very much, Professor Titus. Good morning from Kampala, and good afternoon and good evening to those of you who are in other parts of the globe. I'm Evelyn Akello, and I'm the program manager of the Monitoring and Evaluation Technical Support Program, which is under Makerere University School of Public Health. It is a strategic information agency, and we dive a lot into digital health innovations. And it is really my honor to be co-chairing this panel. And as Professor Titus said, we have lined up for you very, very interesting presentations. I hope you will really have a great time. Back to you, Professor Titus.
Thank you, Evelyn. And maybe you can give me a short feedback how the presentation looks like on the screen, because this always sometimes is a little bit different from time to time.
You need to go into slideshow.
Okay, it should be there. Then let me do this. I'm just enlarging the screen and we should be all fine and set doing it like this. Then we do not play too much around.
Okay.
But I hope this is good enough now and large enough. So the first speaker, unless she just joined a minute ago, Melissa, can you please say if you are in or out? Yeah, she still had trouble to connect. That's why I would like to suggest to go to the second speaker. Evelyn, do you want to announce then Alexandros Pashos, or shall I do that? We are mixing up now a little bit the orders.
Please just go ahead and announce him. I will take the next speaker.
Great, fantastic. So I'm then happy to announce Alexandros Pashos. He is from Luxembourg, where he is heading a very interesting initiative about e-health. It's about a platform that aims to set standards and interoperability between tools that have been established years ago already sometimes in terms of telehealth, e-health, e-learning. And Alex will a little bit talk about how he is setting up this platform, who can use it, and what are the aims for the future. Thank you, Alex.
Thank you, Dr. Titus. It's a pleasure to be here today with you, colleagues, being part of the World Health Summit, the regional one in Kampala. I will talk indeed about SATMED. I am working as a project manager at the SES Networks, SES being one of the leading satellite operators. And we can proceed whenever we're ready, Titus.
Okay. Just going over the first presentation.
Thank you. So let's go and start a bit about explaining what exactly is SATMED and what exactly is the SATMED project and its governance. So the SATMED project is a project that is funded and underpinned by the Luxembourgish government. It is then designed, implemented, developed, maintained, and disseminated within the user groups by SES, SES being the satellite operator. And at the third level, we have governmental organizations and NGOs with whom we work very closely into redesigning, getting feedback and new requirements from them. And at the bottom of the pyramid, we have the end users. So the end users that would like to use the platform for performing telehealth and other activities. Next slide. So SATMED started back in 2014. It is already a lot of time that this project has been undergoing. It started with 4 pilot partners with whom we worked closely into designing the platform and to understand what exactly were their needs in Asia and Africa. So the first phase of the project was in 2014 and ended in 2017. Then the project got extended until 2020. We tried to position ourselves better in the digital health ecosystem. And now we're in the next phase, what we call 2.0, where we're trying to scale up and get more partners involved and users in the platform. Next slide, please.
Oops. Okay, sorry.
So this is where SATMED has been deployed so far. We are present in Sierra Leone, Guinea, Niger, Benin, Eritrea, Bangladesh, and the Philippines. We have various partners which are either governmental organizations like the German Development Agency, or we have also a number of NGOs that are either from the US like CURE or from Europe, but mainly European government NGOs. In the next slide, we will see some of the awards that have been given to SATMED from 2016 to 2020. And we've been present in also recently to the Paris Peace Forum. Out of 800 projects, SATMED was one of the selected ones to exhibit in the Paris Peace Forum. And we also got various awards, also from the satellite industry, but also from various digital health forums that are taking place. Next slide, please. I won't go into the details here, but here you can see, if it is visible, what are exactly our partners are working with, and a number of procedures that they do per year in these remote sites where they are present. So we have Archimed and Cure International. The other ones, next slide, please. Being the German doctors, which are very active and present here in Sierra Leone. This was actually one of the COVID-19 task forces in 2019. But there's also some information about the number of patients that are treated per hospital where SATMED is present. Next slide. Yep. This is the Friendship NGO. It's an NGO that is having its headquarters in Luxembourg, but is also present in France and Belgium and other areas. They operate hospital ships. The one that is shown in the picture is the Emirates Friendship Hospital. It is based in the northern part of the country. And here you can see some really interesting figures on how many patients are treated per year within these hospitals in Bangladesh. Of course, Bangladesh being one of the most populated countries in the world. Next slide, please. So this is the last deployment being in Guinea Farana, and the partnership we had with the German Development Agency. We are currently working in some projects around hygiene with this hospital, but this has been recently launched as a project for SATMED. Next slide. So yes, this is the most important, I would say, slides, and describes how SATMET was initially launched and what SATMET wanted to achieve. So as we all know, that there are so many e-health applications and software that can be used around digital health. So the landscape is really immense. And this is what SATMET wanted actually to not do with when it was started in 2014. We all know that there are so many good applications, especially some open source applications in digital health and for telehealth. And what SATMET wanted to do actually was to combine all these applications in one single platform and use a single sign-on mode in order for you to just log in once and have access to all the applications that are available. We will see more about the applications in the next slides. So within SATMET, we offer a lot of applications that are mainly around e-care, e-learning, and health information management systems, but also patient record systems. The purpose was, of course, to help our partners to not have to pay for baseline ICT infrastructure. So we provide also networking and some basic IT infrastructure to them. And via the satellite connectivity, wherever they require satellite connectivity, they can create this digital network and communicate with either linking their health centers or linking mainland hospitals. And in general, the purpose was to provide a number of applications, also including medical training, so e-learning applications into one single platform. Of course, SATMET can be used in all kinds of devices, so Android phones, tablets, or desktop PCs. Next slide. Yes, we will briefly see how SATMET works. And please, Dr. Titus, just give me a nod if we have how much minutes we have, how many minutes we have.
You are now having about 4 minutes left.
4 minutes.
No, not 4 minutes, sorry. I have to correct me, about 3 minutes.
3 minutes. So let's go quite quickly, slide per slide. This is how SATMET is interconnected. So we can see how you can both connect via the internet, so casual internet, and connect the remote site, or use the satellite fleet of SCS in order to provide connectivity to this remote site. Next slide. I won't go into details, but this is how we can enlarge the network in the remote site. So either we have a single site or point-to-point sites to enlarge connectivity in the remote sites. Next slide. This is the user and group management, and I think here is the essence of how we managed to create this single platform. So we have a user group management system where people, according to the group where they are, they have access to applications and to the users that they are connected with, according to the group where they are part of. And we have 3 levels of groups in SATMET: entities, which is assigned to NGOs or governmental organizations. And then we have groups and subgroups within the system. The next slide is quite maybe difficult to understand, but this is the essence here is how a user gets access into one application as long as he is part of a certain group. So within groups, we assign access over applications, and this is what we call a role-based access system. Next slide. Yep, so we'll go briefly into the SATMET applications that have all been integrated into the platform. We have a user profile where you can manage your profiles and languages. You have your name, your email address there. You have the group management where you can create groups according to the groups that you're a member of. So, for example, doctors in orthopedics would create a group in orthopedics.
1 minute left.
Connect with each other. We have an internal notification system for you to get notifications from the applications of SATMED. Next slide. We have the cloud radiology system, which is a web-based PACS viewer that you can upload DICOM images that are anonymized once they are uploaded and share them with other users. We have a conferencing tool, which is a casual conferencing tool. We have the consultancy tool where you can create medical cases and also attach DICOM images within these medical cases. Next slide. And we have integrated a variety of open source applications. So we have DHIS as an application, which is a well-known health information system in the open source world. We have Moodle, which is one of the best e-learning applications. Kobo Toolbox, which is an application to collect data in forms, in types of forms. And this can be also used with offline Android devices and applications. Next slide. We have integrated OpenMRS, which is the well-known electronic medical record application, and also Rapid Pro, which is an application to send small interactive notifications via mobile phones and create this kind of interactive flow engines. I don't know if we have some time, but this was a small video presenting the platform.
But very short movie would have time, but you reached your 10 minutes speaking, so.
Yep, indeed. Thank you, Titus. And I'm delighted to answer if there are any questions. I don't know if we do it in the end or right after the presentations. It's up to you.
Yeah, because we need to change then the screens. Maybe we can open the discussion first. So some echoes. So I would like to ask now the panelists to ask questions. I can't see the questions from the audience, unfortunately, unless the technical advisor gives me an idea how this should be possible. It's impossible, isn't it? So in this case, I would like to ask, I see now the questions and the F&A. So that's also something I would like to say to the audience. Please ask the questions via the chat function. I forgot to mention that. You're more than welcome to put your questions in and we will read them and discuss it further. So one question I just see here popping up from Josie from HI Uganda is if you can elaborate a little bit about data confidentiality.
Yes, so for SATMED, what we did, and I think anyone that would develop an e-health platform, data confidentiality is the number one of your requirements that you need to examine. So what we did, I think is what everyone does within these cases is to have security and confidentiality by design. So,
hello, Alexandros.
Yep.
Please, can you use a full screen for your presentation?
No, he can't. I'm sorry about this. I will enlarge the screen as much as possible, but otherwise I need to switch the devices because I have a double screen and it's not doing it properly.
Maybe you can use a different type of presentation. You use full presentation on those lower buttons.
I will take care about that, but maybe Alex, he can first of all answer his question.
Okay, yeah. Please.
Sure. I'm not handling the presentations. It's done by the host. So yes, on confidentiality, what we do was we implemented security confidentiality by design, which means that whenever we upload or we have to deal with sensitive data, we either use techniques like anonymization or pseudo-anonymization. And as I said, when you upload, for example, DICOM images in the system, the DICOM tags that are referring to sensitive data are automatically removed from the picture, so from the DICOM picture, so that we are compliant with anything regarding data protection. We have also sought counseling from the National Data Protection of Luxembourg, being part of the EU, and the EU being one of the most strict, let's say, having one of the most strict regulations in data protection, especially the GDPR. So we have taken under consideration all these aspects related to sensitive data and confidentiality.
Okay, there would be time for one more question, a very short one. Is there anybody from the panel? Okay, Jay, you raise your hand, and Evelyn, you too. Okay, maybe 2 short questions.
Thanks, Titus. My question to Alex is about data jurisdiction or data sovereignty, because many countries are now talking about it. And especially when you have a program like this spanning over several continents or regions or countries, how do you ensure data jurisdiction? Like, has any one of the project sites have come forward and then say the data has to reside locally, or sort of it resides as a provider with SATCOM?
Exactly.
SATMET, sorry.
So by design, SATMET also provides the possibility to have instead of only running the cloud platform, you have the possibility to have local remote instances. So this has been also implemented by design. And I would explain in one case where we have Emirates, which is the electronic medical record system. This is impossible for us to host it in the cloud. And therefore, we install local servers in the places where we are present. And then this data is hosted locally, especially in cases like medical record system. It would be impossible to host them in the cloud due to these jurisdictions. But also, all data that are being pushed to the cloud, it has been agreed, since this is a project that is publicly funded, right? So we have here the state of Luxembourg supporting this project. We have no intention of keeping this data. So whenever a partner might request, I would like to get all these data back that are hosted in the cloud, we will certainly do so. This is one of the requirements that we have actually within the project.
Thank you, Alex.
Thanks a lot, Alex.
Evelyn, are you still taking your question? Or are you putting it back and we should move to the next?
I think we can move to the next. I'll hold my question. Thank you.
Yeah, thank you, Evelyn.
I see Melissa in the attendees. Can we promote her to the panelists? Thank you.
Yeah, that's something maybe, Alex, I would like to ask you, maybe you can communicate with Melissa.
Yes, we'll do that.
In the background.
Just like to thank you everyone for the questions, and yes, I will do that, Titus.
Thank you. So Evelyn, then it would be to you to announce the next speaker, please.
Thank you very much, Titus, and thank you very much, Alexandros. The next speaker we have lined up is Dr. Joseph Adibola, and he's the president of the Society for Telemedicine and eHealth in Nigeria. And he will be speaking to us about the do's and don'ts for implementing a successful digital health network. And he's speaking on behalf of the International Society for Telemedicine. As his slides come up, I'll just briefly introduce him. He's a Chief Technology Officer and a partner in Home Plus Medicare. Dr. Joseph, over to you.
Thank you very much, Evelyn, for that introduction. Professor Titus, co-panelists, and the attendees on this call this morning. It is a great delight and a pleasure to be speaking at this World Health Summit. Of course, the section topic is digital health, its promises, its challenges towards SDG 3. But I'll be addressing the do's and don'ts for a successful implementation of a digital health network, just like we had from the first speaker, Alexandros. What does it take, particularly in the low resource settings, to ensure that we have a successful and a sustainable implementation of digital health network? Next slide, please. It's very important, before I start addressing the do's and don'ts, to also look into some of the potentials, which we grind some of the do's and don'ts bullet points on addressing the issues of what steps to take in order to ensure a successful and sustainable implementation of your planned digital health network. Whether you are doing this at the primary healthcare sector, whether you want to implement digital health at the secondary healthcare level, tertiary care level, a super special hospital in a region, across the region, or internationally, like we have seen from SATMED, digital health quite holds some promises towards well-being for all and all ages, and it is going to optimize revenue increase for everyone along the value chain of digital health, which includes government, health service providers, and most importantly for the citizens, improved health outcome. So what are the do's and don'ts? It's important as a vendor or a software developer, or you're a programmer in your Ministry of Health, or you are the head of your hospital, head of digital health. At inception, it's important to first of all scan your environment. You conduct what is called environmental scanning, in which we help you to determine the needs assessment for the kind of digital health tools and services that you might want to deploy. Is it for health financing? Is it for point of care services? It is to improve communications between healthcare providers. So it is very important that you first conduct a needs assessment to ensure that your digital health solutions aligns to the health system needs or health service delivery needs of that particular entity that is venturing into digital health network implementation. And most importantly, when you scan your environment, the essence of doing that is such that you have a roadmap. We all know what a roadmap means. It's a framework that helps to guide your implementation towards success of any venture. So in developing that roadmap, the first thing is what is happening in the environment. Now, from the WHO ITU publications of the International Toolkit for Electronic Health in 2012, it talked about the national environment, the national context for e-health. It is important, as this is very important, what must be done. Very important to know the level or the stages or maturities where your national e-health environment or environment of that location where you want to deploy your digital health. And what are the things that you must look out for? One, are there leadership and governance structure available, okay, in that facility? Okay, if it's a healthcare setting, if it's a national digital health program or a regional program, do we have a coordination mechanism? Because this is very important to provide leadership and governance, essentially. Of course, you have to look at, again, are there any planned strategy for investment? Okay, how do we source the financing? We've seen that from SATMED presentation, it could be capital intensive initially to start, but the ongoing cost as well as the cost of startup. So it's important to have your strategy and an investment plan for your digital health program. Also, what about the workforce, capacity building, particularly in a low resource setting? How do you intend to mobilize the needed workforce, their technical capacity? Do we have them enough, particularly to sustain the kind of digital health intervention or network that you want to implement? Also in the environment, you want to know what are the policies that you need, requires compliance as a vendor or as a program manager. You want to also be aware of legislative frameworks? Are there any regulations or legislations in this particular region, particular state, that could impact the success and sustainability of your digital health network? Most importantly, also the infrastructure. What is the infrastructure like? What is the current government plan for infrastructure? Now talking in terms of power, in terms of telecommunications, broadband network. Are there any strategy from government, any planned increases or expansion over the years to certain areas where you have identified needs to deploy digital health? And most importantly, you need to also talk about architecture, which is important for interoperability. We need to also find out there are standards out there. Are there standards in the region, in the location, in that country where you need to design, okay, and develop the digital health networks in line with. And most importantly is the services and applications that must be deployed. The earlier presentation have shown us the e-learning platform integrated, of course, ability to make medical consultations. All of these shows alignment to needs. So these are the do's, ensuring that you take a critical look at your environment to see that it is enabling enough for the sustainability and then a successful implementation of your e-health. What where the don'ts are? Don't design in a small scale. It always makes sense. And that's why we have so many digital health pilots across the globe today. Most are not sustainable. They cannot be scaled up because they are designed for pilots. You might say, oh, doctor, you ought to start with a pilot first. Most importantly, ensure that your digital health network is aligned with the local health system needs. Also, ensure that at conception and design, they are designed for a large scale. You are thinking of a digital health network that will be able to scale up incrementally over time, meeting the needs. Of course, it's important that the next step is involve stakeholders. Stakeholders are very important. There are broad stakeholders from government to the private sector to the academia.
Excuse me,
Can you hear me?
Yes, we can hear you. Would you like to have Titus move your slides, or you don't need to have your slides moved?
Now, after it, I will move to the next slide. Not yet.
All right, lovely.
Thank you very much. So the next is to apply an economy of scale, because we are talking about the do's and don'ts for a successful implementation of digital health network. I said, don't design for a pilot, design to scale and design to sustain, okay? And in doing that, you need to map out the various broad stakeholder groups. And you also need to think of what other infrastructures can be scaled up. Do we have any digital infrastructure, telecommunications infrastructures, or existing projects in other sectors like education, okay, agriculture, or digital economy that your digital health suits or solutions can ride upon to reduce the cost of ownership? It's also important to be very iterative and innovative at the approach to ensure that technical considerations using open source tools is very important. We saw that from SATMED, that if you want to be successful, open source applications and reusable tools is very important. This way, you avoid duplication of efforts and reinventing the wheel. I mentioned ensure you design to scale, and then using the standards and architectures that are open allows interoperability. And take note that you must think of commercialization. For sustainability, it is very important that you resource how funding will be taken care of. I don't know how much time I have. Next slide, please.
And I was just going to tell you that you have 2 minutes of presentation left.
Yes, next slide. You can now take it to the next slide. So I've shared with us the promises that digital health has towards achieving Sustainable Development Goals 3. I've been able to address the do's and don'ts that we all need to put to mind it whenever we want to set out to deploy a digital health network, but we still have challenges. What are these challenges? Even though COVID-19 pandemic has been able to drive the uptake of these technologies in use in the health sector, we still have self-limiting cultural beliefs from one part of the world to the other as to how issues can be handled, particularly issues of data governance, data protection, its security, privacy, and which has shown a bit of a slow adoption by citizens, also by healthcare providers. In most of our countries, particularly in Africa, policy is not there. Most of our health insurance, social insurance, pay for services provided by digital health network is not very clear. I know South Africa is taking a very good lead during COVID-19. A lot of digital health tools were deployed with insurance companies allowed to make some payment fees for service and capitations. Of course, we cannot talk about implementations without our infrastructural deficit. Thank you very much. I think I've come to the end of my presentation.
Yes, you have. Lovely. And you have time for Q&A. And again, I want to remind the attendees, please post your questions in the Q&A so that we are able to see it, so that the presenter can be able to provide a response. I do not see any questions popping up. Panelists, would you like to put some questions to Dr. Adebola?
I would have one question, Evelyn.
Yes, go ahead, Titus.
Thank you so much for this great presentation. And it's nice to see how ambitious you are there with this topic. And one thing you mentioned quite often was one thing for success is sustainability and scalability. But I'm asking myself, what is needed for sustainability and scalability again? Yeah. So what is—
Thank you very much. Thank you very much, Titus. For sustainability, one, you must have an enabling environment. And what is that enabling environment? We have the component of the National Digital Health or e-health enabling environment. Is very important because it's the enabling environment that ensures that all the pillars or components of an e-health contest is in place. Also, you need to have a financing mechanism, a strategy and investment plan, a financing mechanism to finance your project. So who will be financing, at what cost, and then at what cost will these services be delivered? Also, most importantly, I made mention about having a roadmap, and that roadmap ensures that in your strategy and investment plan, you are able to have your contest right, that is addressing the needs of the health system, one, and then secondly, your actions, that is the activities to ensure that you're able to achieve your goals of deploying the digital health network. And thirdly, you must have your monitoring and evaluation plan. All of these are concepts or ab initio designing the digital health network. That way you can be able to monitor your progress and then ensure that you are meeting the needed performance or the essence of deploying the digital health network. In terms of sustainability, you need stakeholders. There is need for collaborations. And then also, who are these stakeholders? Is a broad stakeholder groups that involves both private, government, academias, as well as the ICT and healthcare providers or the ICT vendors. I hope that is clear enough.
Thank you very much.
Thank you. We have time for one quick question. I don't see any in the Q&A, so I am going to take the prerogative as your chair, Dr. Adebola, to ask you a question.
Please go ahead.
What is your experience with digital health workforce development? I know that that is one of the biggest challenges that we have in digital health. So what are your thoughts on this?
Yes, it's quite a challenge for us in Africa, particularly sub-Saharan Africa, where there are low technical capacity for this. Quite a number of evidence in the literature pointing to that. And looking at my home country, Nigeria, we have a national EH strategy for 2015-2020 that elapsed last year. Fortunately, I've been hired by the WHO to help the Federal Ministry of Health to quickly look at the evaluation. You realize that the critical gap was the lack of the adequate skills and knowledge in either health informatics and digital health. First, at the managerial level of those who are responsible for the day-to-day implementation of that strategy, and then you have at the middle level, particularly for the workforce in general. And the only way to improve technical capacity to ensure successful implementation as part of project design and project implementation for digital health network, a critical amount of the budget must go into training, into capacity building of the workforce, not just on the deployed platform or the digital health solution, but providing basic education, okay, to build the soft infrastructure needed both to own the digital health network and also to maintain that digital health network over time. So two kinds of capacity building here, one quickly on the platform to be developed, to be deployed, and then secondly, on the rudimentaries of digital health or health informatics, that enables us to build capacity because now we have more projects than the workforce capacity so that we don't introduce further divide deploying digital health. Also, national government must take the issue of workforce capacity seriously by looking into undergraduate, postgraduate curriculums, as well as ongoing professional trainings to ensure that we start including as part of personal or professional developments, career paths. And in most countries, we don't have a career paths in a national scheme of services for a digital health qualified personnel. So all of these are issues that needs to be looked to ensure that in terms of workforce capacity building, both HICT, both the healthcare workforce, so that they can understand the technicalities of the two sectors combined together in digital health. It's important to have this scale up and short trainings and then outreach courses, and then to improve the technical capacity of the workforce in the African region.
Thank you. Thank you very much, Dr. Adebola, for a very, very interesting session. Carol Ondora, you have a question about countries imposing tasks and regulations on internet use and what modern mechanisms can be deployed to allow access to learning. We'll answer that question in the chat. I'm going to ask Dr. Adebola to type his answer for you so that we can have the next presenter come on. We will definitely provide a response. Over to you, Titus.
Thank you, Evelyn. And I'm very pleased to now announce the next speaker. This will be Jay Ganesh Udayasankaran from and he's a part of the governing committee of the Asia eHealth Information Network, known shortly as AHIN, and senior manager healthcare information technology and telehealth at Sri Satya Sai Central Trust in India. And he's talking about the role of regulations in the practice of telemedicine and digital transformation in healthcare. And I think this is a super link from the past presentation from Dr. Adebola. And I'm looking forward to hearing you, Jay. Thank you for talking about this important topic.
Thanks, Professor Titus. And I thank the previous speaker because he raised this important topic of having the regulations and for telehealth. So this is one of the key success factors, I would say, in countries. Let me go to the slides. If possible, if you can maximize, right next to the slider, there is an icon for maximizing, if it is possible, otherwise it's okay. Yeah, so just to give you a background, India, as you would all be already aware, is the second largest, seventh largest country with the second most populous country with so much of diversity in terms of geography as well as languages. As you can see, there are 22 major languages, and there are 28 states and 8 union territories, and the population is just catching up with China, being the second most populous country in the world. And health is a state subject in our country, and the public spending is about 1.29% of the GDP as of 2019-2020. And the doctor-patient ratio, this is something that I would like you to note. This is not exactly as per the recommended ratio of 1:1,000, but it's sort of lower. So that brings about a disparity with most of the specialists, like India being actually one of the exporters of, I would say, medical tourism. And then most of the doctors abroad in NHS UK or the US are all Indians. And then even then, like in India, like we have most of the specialists living in the metropolitan areas. So we do have this disparity of access to them. And this is just a map like to show that how many countries can actually be put over within India, like in terms of the population. Thank you. Can we move on to the next slide, please? Telemedicine in India is not something new. We have been there for the last 2 decades. I would say that from 1999 onwards, there have been telemedicine projects. There are a few hundreds of them supported by Indian Space Research Organization as part of their contribution of using space technology for societal benefits. And then, of course, like we have also been exporting, I would say, the services for other countries in the world, like for example, US, especially the hospitals in the US, where Nighthawk teleradiology is one of the popular services that is being offered from India-based radiologists who are both certified, and then they offer the services to the US. So this is something that telemedicine is not something new, but then still there was always the question that whether telemedicine does have a legal status in India. There was this ambiguity, I would say, though there were people who were actively practicing. So as with most of the digital transformation efforts, COVID is again a great catalyst or enabler of digital transformation. And though there have been discussions from, I would say, maybe the later half of 2019 regarding having telemedicine or digital health specific regulations in India, but things were taking time. But then thanks to COVID, they were fast tracked, and Government of India brought about this telemedicine practice guidelines on 25th of March 2020 to make sure the nation really needs, especially in times of lockdowns where people have difficulty in going to their hospitals, the brick and mortar hospitals, and then they wanted to encourage the physicians in the country to provide the services via telecommunications, telehealth. So they brought out this regulation. What I would like to impress upon is just that one act, though much delayed. And then even this telemedicine practice guidelines, I would like to sort of explain a little later in detail, where it is limited in scope. They didn't want to complicate things because the main objective was to encourage more doctors to provide services online when the patients are not able to come to the hospital. But this important step, as you can see chronologically, it brought about a chain reaction, I would say, or it's like a cascading effect where one led to the other. Though this guideline was for the modern form of medicine, which is known as allopathy, but then even the alternative systems of medicine which are practiced in India, like Ayurveda, Siddha, Unani, and homeopathy, even those councils brought about their own practice guidelines within a fortnight. So that is an impact this particular regulation had. And then, of course, like within a month, in the month of May, the law was actually, the practice of medicine was actually amended. The particular terms were amended, and then it became a law which was published. I would say, notified in the Gazette of India. And then, if you can see the next steps, like especially by the month of June, the Insurance Regulatory Development Authority of India, which had so far actually means the insurance providers in India had so far not been covering telemedicine consultations. But then, once the regulator brought in this kind of amendments, and then that kicked in. So from the month of June, and then of course from October 2020, now telemedicine consultations are covered by the insurance players in India. They didn't need to have a separate policy for that. So this is going to be one of the major success factors, I would say, for further wider acceptance and adoption of telemedicine in the country. Next slide, please. So telemedicine practice guidelines, the scope has been kept simple, as I mentioned earlier. It just talks about who is eligible to practice telemedicine. It can be done by a registered medical practitioner, and registered medical practitioner is someone who is already registered with the Indian Medical Council, and then they are eligible and entitled to practice allopathy form of medicine, that's modern form of medicine, and they are the ones who can actually provide teleconsultation. And then, of course, like it covers the norms and standards for the registered medical practitioner, and then in what different communication channels can be used, and then also a list of exclusions, because they wanted to keep it simple right now. They don't want to talk about artificial intelligence, use of artificial intelligence based systems for telehealth, or into the research, or having someone residing with outside the jurisdiction of India to provide these consultations. Those are the exclusions. Next slide, please. So I would say that focus on these 7 elements. That is, the telemedicine practice guidelines establishes a context for providing the consultation, and it necessitates a positive identification of the doctor and the patient. It is not it prohibits anonymous consultations, and of course, like there has to be a consent. Implied is when the patient themselves seek the services, and then of course explicit consent is sought when the provider has to actually use that for a further referral or storage. And then different types of consultation, which is the first consultation or the follow-up, and then the patient evaluation. It is a lot of it is left to the clinical judgment of the physician, and he or she has the right to refuse a teleconsultation. They can always refer for a physical consultation if the information that is transmitted or available to them is not sufficient. And then, of course, it also talks about prescription, because online prescription is something like India still does not have a formal thing for e-prescriptions. It's still in the draft. So like physicians are actually given three sets of things, like what can be prescribed without consultation, without a video call, or without meeting the physician in person, and then what can be done only after meeting in person. And those suggestions, or I would say that requirements, are also mentioned in the practice guidelines. Next slide, please. Okay, this is just to give you because there's a huge, I would say, the collection, a plethora of laws that I can say that governs or it can be applicable to digital health or telemedicine in India. But broadly, there are those who means we still till this practice guidelines are released by the government, we did not have something very focused on digital health or telemedicine. But then most of the laws and regulations which are applicable so far has been either related to the practice of medicine, or related to information technology transactions, or related to intermediaries like telecom providers. So next slide, please. So a couple of laws I have mentioned, which are still in the parliament, which are going to make a major difference in the country in the next few years. One is related to health information security, and then of course the personal data protection bill, which I would say is an equivalent of GDPR in the EU. And this is still debated in the parliament, and then hopefully later this year, I think it should be come out as a act, the parliament, and then this is going to have a major impact on the practice of digital health or telemedicine in the country. Next slide, please. So, like as I mentioned, there are other sets of laws which are also applicable, which are related to the intermediaries, related to telecom. Next slide, please. just wanted to highlight a couple of national initiatives. I would say that these are of national scale. One is this stay-at-home OPD service, which is available pan-India. It's promoted by the government. It is available for free of charge, and it's like people can actually register for it and then seek a secure video consultation with doctors. The doctors are from the respective states, and it's absolutely available free of charge. Next slide, please. And one of this, I would say that a trigger of the regulations brought about is like the practice means it basically brought together a lot of people to start working for bettering the regulation or how to implement it. So Telemedicine Society of India, along with other partners, took up this task of volunteering to train a few millions of doctors, because not everyone was conversant with the telemedicine practice guidelines. So they wanted to bring about the fact like what should be the do's and don'ts, and then on those who have still not sort of familiar with the practice of telemedicine, they wanted to bring them to that stage. So they brought about this free certificate course, which was online. In fact, within a fortnight of the release of telemedicine practice guidelines, this course was made available to them online. Next slide, please. And this is another effort again, which is I would say public-private sector participation and contribution towards the country's telemedicine development. We did not have a telemedicine registry in India. Like the moment these regulations came about, there were hundreds of applications related to telemedicine mushroomed, and everyone was talking about some kind of an app or telemedicine software. So individual practitioners as well as hospitals were finding it difficult to make a selection which actually conforms to the standards, which will help them to actually meet the statutory requirements from the government. So what happened was Telemedicine Society of, the Digital Health Association of India, along with few other partners supported by the National Research Center for Electronic Health Record Standards, they took up this effort of evaluating various vendors and their solutions for telemedicine. The vendors were asked to actually register for free, and then they were evaluated by a panel, and then there was a registry was made categorizing various applications. So this was very helpful for the individual physicians as well as the providers. Next slide, please.
1 minute left.
Thanks, Titus. So I would like to summarize, like I'm sure that I don't need to sort of emphasize on this. Digital transformation in healthcare is very complex because it involves, it's typically multidisciplinary. So there is an information technology aspect, it's a digital aspect, as well as the healthcare as such is a complex domain. So it certainly involves multi-stakeholder conversation and involvement. And this is my favorite example of tree for digital transformation of health services. Next slide, please. So in general, regulation, when we talk about it, can do a lot of good, and then it can certainly set the pace. But regulation always, like I'm sure that you all already know, that it has the spacing problem. The business challenges as well as the technological developments are always several steps ahead. And regulations typically are iterative. They say as good as a software. Iteration is better in terms of regulation. It can either promote innovative practices or it see the growth. So it is very important to have good regulations in place, and the whole of government approach with as much public consultation is very helpful. And I'm done with my presentation, and then I'm ready for any questions that you may have. Thank you.
Thank you so much, Jay. Thank you very much. Is there any question from the panel? We have time for one short question. If not, I would like to ask you one question. I mean, there obviously has been a big boost in telemedicine in the past years, and COVID also showed us how comfortable it is sometimes to ask, to request the physician being at home. Of course, it shows us also its limitations. But my question is, in how many years do you think teleconsultations the doctor to physician connection will be done purely based on artificial intelligence and chatbots? 5 years, 10 years, or never?
I think it's possible. I would say that, to some extent it's already happening, in the sense like we do have a lot of chatbots. In fact, tomorrow there is a WHO session on chatbots, so I can send you the registration link. And there's a lot of effort. Even in India, there are efforts related to, I would say that, for reading chest X-rays related to COVID, and then basically triaging. So it's already, I would say that I don't think we need to talk about in terms of years. It's more related to sort of having this governance related. For example, like I talked about telehealth governance, this similar set of regulations for use of AI in healthcare has to come. I really appreciate the recent development in EU related to artificial intelligence, just like GDPR. Like I'm expecting that to be a benchmark for many countries to follow. So WHO has also released, as of yesterday, there was this publication from WHO that talks about AI governance and ethics. I can share again right at the end of my presentation. I can share the link. So it's very much possible. It's being already done more as a pilot. So I'm not very sure whether should I give the years in 5 or 10 years, but it's already being used. It's just that it has to be regularized.
Thank you so much. Alex, do you have one short question? If it's a long, I would ask to put it at the end of the session, but
I think it's quite short and has been already mentioned by you, because we discussed about digital transformation and the recent pandemic, existing one, COVID. Maybe a comment from Joy on how COVID-19 maybe accelerated digital transformation and the usage of telehealth in general, or maybe more specifically in India, maybe.
It has already, I would say that it has already done. The very fact that the government brought about or fast-tracked the regulation is just because of COVID. Otherwise, probably it would have taken much more time. And then I would say that India brought it out in March 2020, and then in the neighborhood, for example, Indonesia, Nepal, and many other countries have brought their own telemedicine practice guidelines, recently Philippines too. So it's happening. And then, of course, like there were developments happening in EU as well as Australia, Singapore, and many other developed countries as well. So it's already happening. It's just that now people are talking about having these regulations become permanent. So because the governments have so far specified these regulations hold good for the pandemic. So people are talking about, like, can we have this as permanent? So that is the level of discussion right now that's going on. And again, there are some surveys already happening. I can share you some examples on that. And then it will be good to have, the main thing is not many people are focusing is about having clinical documentation. And then what are the guidelines for that? What are the standards for that? Like, because right now, even in the government of India, in fact, I'm part of a telehealth standards committee. We met just day before yesterday. We are actually working on developing such standards, and then which will sort of aid or recommend to the government in terms of clinical documentation and various aspects of telehealth services.
thank you so much. Evelyn, it's up to you now again.
Thank you, Titus, and thank you, Jai, for that session. And it is my pleasure to introduce the next speaker. And I would like to introduce Stephen Waning, who is the secretary of the Helena Network. He's also the board member for Open Emirates Global Community of Practice. He is the founding secretary general of the Kenya Health Informatics Association. And he is also a board member of Open Emirates. Stephen has very, very rich experience in digital health, and I have had the pleasure of working with him. He is going to take us through how to scale up and make digital health solutions sustainable. An interesting topic. Stephen, take it away.
Great. Thank you very much, Evelyn. I hope I'm audible. So thank you for the introduction. And as Evelyn mentioned, my name is Stephen Onye, and I'm really happy to be here this morning to participate in this World Health Summit meeting alongside these great, really eminent panelists, and definitely really enjoying the audience and interaction that is ongoing. So my topic today, which has actually been made a whole lot easier by the speakers who have come ahead of me is on how to scale up and make digital health solutions sustainable. I think, as we all know, most countries, particularly in Africa, have been investing rapidly and really significantly in digital health. I think the evidence for digital health has become a lot more convincing over the last several years. And therefore, we are seeing a lot of governments, Ministry of Health, leading this, really, really firmly and working very closely with their partners to invest a lot more in digital health. And I think this topic of scaling up and sustainability then becomes really important. And I'm really happy that the World Health Summit found it fit to have it as one of the key topics to discuss. So next slide. Next slide. So basically, I'll start. So my presentation is in two parts. So sort of like recapping a little bit of the important basics. I think it's important for us to go back and just ensure that we are well grounded and anchored in digital health, and ask ourselves, where exactly is this coming from, and why is it important? What are the key things we need to remind ourselves about? And again, as I mentioned, the previous speakers have really extolled the where this is coming from in terms of its grounding, its history, and all that. And so I'll just touch on that really briefly. Next slide. So one of the main references I wanted to make with regards to one very, very important basic is, I think when we ask ourselves, why is digital health becoming so important, trendy, exciting, and all that, we have to relate this to where this is coming from. So I think, as we all know, the role of the World Health Organization is very clear in terms of being the custodian of healthcare across the world. And this custodianship is held in trust for its member states. Right now, I think there are about 194 member states to WHO, and these member states are the ones who give WHO that mandate, that legal right to sort of represent these countries in terms of health matters across the world. And so, when 194 countries think it's important to invest in something, but then WHO represent them, I think it's something we need to take seriously. So I think, as we know, for those who are familiar with how the World Health Organization works, there's a World Health Assembly that happens every year, and that's where resolutions are made. So historically, and in terms of how things have come to be from many years ago, there are a couple of key events that have happened over the last several years. So in May 2005, there was a resolution 58.28 made by WHO on e-health. Then again, in May 2013, there was another resolution, really key resolution that's relevant to this topic, that was made on e-health standardization and interoperability. And then again, in 2007, which I should have mentioned earlier, there was also another resolution made on health technologies. And the most recent one, which relates very, very directly to this topic today, was made in 2017, again in May, on digital health. So it's really important for us to make reference to these key events that have been made by WHO, representing the 194 member states who basically give it the mandate to take care of healthcare across the world. Next slide. Another sort of important development that I think we need to look at is when people are talking about investments in digital health, or in anything for that matter, then you have to ask, what is the basis? What is the return on investment? What is the value for this and to who? So one of the things that have been happening over the many years, and this is just one of the many references, is that WHO has, through its new department for digital health and innovation, they've been able to publish a very, very important guideline called the Classification for Digital Health Interventions. It's a taxonomy document, basically, that provides a lot of very strong evidence for digital health. And so one of the important part of the content in that document is the way they've laid out, sort of like a causality logic in terms of showing what exactly is the impact, or what should be the impact of investing in digital health across the healthcare system. I think most of us are familiar with the WHO health system strengthening building blocks. Most of us can recite that even in our sleep. And so I think, as I mentioned before by one of the speakers, it's important to look at the entirety of the health sector and ask ourselves, what are these important things that a well-designed health intervention needs to touch on? And I think we all know the challenges of doing things, in a silo or in a very constrained, limited way, that the effect of that and the value for that in the long term doesn't last long, and it's not even sustainable. So if you look at things from that perspective, or from that lens of health system strengthening, then you have to ask yourself, what health system challenge is digital health intervention or solutions trying to address? And therefore, what you're seeing in front of you on the slide then is an example of some of the health system challenges that a digital health intervention or solution is intended to address. And so if you click, go to the next slide, then the document that I referred to earlier about the classification for digital health solutions have what WHO terms as digital health interventions. These are the discrete features in every system. In this case, when I'm using the word system, I mean a software solution like an EMR system or a health management information system like DHIS2, what Alessandro's presented on SATMED, all those are digital health, they are categories of digital health solutions. But within those solutions, there are features. Now, the way this is, the terminology being used by, at least in this document, is a digital health intervention. So if you're thinking about a feature such as a reminder system, clinical decision support and all that, that is the most discrete intervention within that digital health solution that we need to ask ourselves, what is the real effect of having that in the system? So for example, when people claim that my mHealth application is capable of sending so many reminders because it's been shown through evidence that if a patient who's on ARVs is sent for reminders in a day, they're probably a lot more adherent to their medication, and therefore you can argue that that in conjunction with the other interventions leads to better outcome of their health status. So what WHO have done working with its partners is really gone to that very discrete level to define and determine what are those interventions that collectively are found in certain solutions that then, when it's implemented correctly, should lead to a certain outcome. So if you go to the next slide, then you're able to complete this sort of thinking. Next slide, please. Yeah, so you're able to then complete this sort of broad thinking, where you look at what is the health system challenge on the leftmost side of the slide you're looking at. So, for example, if you look at the bottom one, if what you're trying to deal with is loss to follow-up of clients, you're running an HIV program in your country, and you have a very high rate of loss to follow-up. So patients are coming, they get enrolled into the program, and then they disappear. And then you figure out that, hey, why don't you implement a digital health solution like an mHealth application or an EMR system, and that within that system, we will implement a reminder system so that we can follow up with the patients, find out where they are, remind them to come back for their next appointment. And therefore, through that logic, you want to address that problem of loss to follow-up, because it's important for patients to stay in care right from the time they're diagnosed all the way until you suppress their viruses, and that they're able to live a healthy life. So that's really, so these are very, very important basic, again, in terms of thinking about digital health and thinking about this topic of scale up and sustainability of digital health. Because if you don't have this very clear basis, then the return on investment that would basically provide this value for sustainability then isn't there. And this is how most systems, at least for most of us who've been in this space for a long time, we have seen systems fizzle out basically, and the excitement dying out because people don't see the value anymore. Next slide. And then the next part of my presentation now will be focusing on what are some of these principles for responsible investment, scale up and sustainability. And some of this, again, as I mentioned, have been touched on by the previous speakers, but I'll still go over them and make some emphasis. Next slide.
And Stephen, you have just 1 minute left.
Okay, I'll try and move faster. So basically, we all know this. We've seen this before. We know about the problem of siloing. The problem of uncoordinated investment. The problem of inflexibility. The problem of pilotitis. And this study was actually done in Uganda when there was a moratorium on just too many pilots and that were not scaling. So again, this is a very important basis for what is the problem and how has that been analyzed. Next slide. This has been mentioned before. Again, the enabling environment. Again, I need to put this here because if you're talking about sustainability and scale up, you have to talk about all the enabling environment. This is well defined by WHO. You can have a look at this resource later on. But there are about 5 to 6 key building blocks similar to the health system strengthening one. Next slide. So then, if you're thinking about sustainability and scalability, you have to know what you have. Based on the previous slide where WHO has defined what is the enabling environment, then people have come up with tools that enable you to assess that, and then you're able to score yourself. So this Global Digital Health Index is one such tool that is being used in many countries, and you're able to then, through a maturity model, define where you are at and how you're going to travel through the maturity model pathway. Next slide.
Stephen, I would ask you to wrap up in the next 5 seconds.
Okay, and then so in my last 2 slides, again, you can go to the next slide, Evelyn. I just wanted to emphasize on next slide. I just wanted to emphasize that there are 2 set of principles. It's donor principles, and then the next one, Evelyn, which is the last slide. It's the principles for digital development. If you go to the next slide, Evelyn, that's my last one. Again, just emphasizing that these 2 are a collection of global principles that have been shown to help in responsible and ethical implementation of digital health to assure scalability and sustainability. Thank you very much.
Thank you very much, Stephen. Sorry to have rushed you. So we are now in Q&A. I would appreciate if our attendees can post their questions and comments. I do not see any coming up. Yes, Maggie, we take note of your comment. We've been trying to do that. I hope the slides are large enough for you to be able to see. Any questions for Steve from the panelists?
I would have, Evelyn, if this is okay, one question to Stephen.
Yes.
Stephen, it's always asked that you make things, if you want to roll out a new project, the first question is it sustainable? And if you think about sustainability, it said, okay, industry or companies must run these things. But somehow these must be also paid by governmental structures normally, like health insurance companies. So how do you see sustainability in terms of, from an economic perspective, in the health domain? Can we really become sustainable, or is that just a shift from one level to another level when we say sustainability? It's, okay, the application itself is managed by a company maybe, but still return of invest is coming from governmental monies.
And Stephen, I'll just ask you to take the second question as well so that you can answer all of them at the same time. Maggie from Makerere University is asking, can you please highlight on key strategies, if any, for the continuity of use of e-health technologies for healthcare service delivery on expiry of health projects or programs in different countries? The question is in Q&A. You can answer Titus's question and Maggie's at the same time. Back to you, Steve.
All right. Thank you very much, Evelyn, and thank you, Titus. So to Titus' question, I mean, I think the one area we have failed in, I think, is I think developing very practical business models, especially in public health. So unfortunately, I think the culture of public health is very reliant on so-called donor funds and all that. And unfortunately, I think many countries have also not implemented private, public-private partnerships where especially the private health sector should play a major role with regards to ensuring that like very good solutions that have been shown to work are actually sustainable. I think at the end of the day, the question is who pays for it? Now, I can only pay for something, or the majority of the consumers of healthcare will pay for something they find valuable. And I think we have shown digital health is valuable in many ways. And so if we take an example of, like, let's say mobile banking, a lot of these mobile banking applications, people pay for them. Even the people we think don't have money at the very low levels, they actually pay for that because they find value. So my question is, why can't we change this model to ensure that, especially the consumers of healthcare, because people will pay for things that they find valuable. But unfortunately, it's a cultural change. I don't think it's a shortage or a problem of business models, but we have to change the culture and ensure that the public sector and the private sector are working a lot more closer to have business models where people actually pay for the services. And then for the second question, Evelyn, sorry, I didn't get it completely. Let me just look at it really quickly here. So Mag is asking if I can highlight key strategies for continuity of use of e-health technologies for healthcare services. I mean, I think it really just goes back to the enabling environment, to be honest. One of the things that we are finding in many countries is there is a dearth of, there's a really huge vacuum in terms of especially policies. There are very few countries, for example, who have digital health bills. We're developing one in Kenya right now, but so it's really it's a situation of chicken and egg where technology, of course, is always moving very fast. But then we're finding ourselves in this conundrum where People don't know how to deal with data, the issues of risk and harm. But then the legal and policy environment and the regulatory environment is not mature enough to allow that to happen as quickly as it can. So countries are making catch up. I would say that's one. The second one is capacity. I don't think we are where we were 15 years ago, for example, when PEPFAR was starting, and there's very limited capacity, particularly in terms of digital health. Now there's plenty of capacity in our countries, Uganda, Kenya, in the whole of East Africa and the rest of Africa. But I don't think that has been harnessed well enough. And as Professor said earlier on, even right from our academic institutions into industry, the pipeline is not well developed and structured, even including like a career progression pathway. You get into government and you're a highly qualified digital health expert. There isn't a pathway for you to progress. And so there are a lot of structural changes that need to happen. And in my opinion, I think if we can do three things, one, I think, is a capacity issue and harness that in a structured, thoughtful way. The second one for me, I think it's really the area around the enabling environment, both in terms of ICT infrastructure and the legislation, policy, and regulation. Thank you.
Thank you very much, Stephen. Over to you, Titus, to introduce our next speaker.
Yeah, thank you, Evelyn. And it's our second last speaker. So don't run away after this talk, because Melissa Andrews managed also to join this session. She had some technical difficulties and she will be the last speaker. So I'm happy now to announce Béatrice Garret. She is the Director General of the Fondation Pierre Fabre. This is a NGO from France, and I guess many of you have already heard from the global activities. And she is presenting about the topic, how ICT can successfully address the challenges of the last mile delivery healthcare services for poor and isolated populations. And she's giving us some insights from her work. Thank you, Beatrice.
Thank you, teachers. Thank you for this introduction, and I'm very happy to be here after all this very brilliant presentation. I'm going to have a more, let's say, down-to-earth approach, and I would like to talk about our learnings with the Global South eHealth Observatory. Can you put the slide, please? So, next slide, please. Yes, in fact, I would like to quote Dr. Tedros. So what about digital technologies? They are not an ends in themselves. They are vital tools to promote health and serve vulnerable populations. And that's the reason why we've been investigating how ICT could help us achieve our mission. Our mission as a Pierre Fabre Foundation, a public utility foundation, is to try to give better access to quality healthcare and medicines to relieve the most disadvantaged populations. And we thought that ICT was an opportunity to accelerate inclusion of the less disadvantaged people into health services. But what we wanted to do is to see by ourselves. 6 years ago, there was a lot of talk and it was a very trendy subject, but we wanted to see what's on the ground, what's really happening, what's really working. And we wanted to go by ourselves, to see by ourselves, and that's why we created the Global South eHealth Observatory. Next slide, please. And next slide, please, too. So this is an initiative we took with the help of the French Development Agency, and other partners joined us. An important partner for us is the ASEAN eHealth Network. Thank you, Jai. And the idea is really to have a focus on mainly it's sub-Saharan Africa, and there was a focus on French-speaking Africa too, and East Asia, Southeast Asia, and India, because it's a real laboratory for e-health. So we act in sort of three ways. The first one is really to collect the information with field surveys, with inquiries, and to be able to identify all these initiatives which really bring better access to healthcare for these populations. And after 5 years now, we've got a database with 165 initiatives, which have been listed and documented from 80 countries. And there are 87 of them taking place in Africa. And of course, what we want to do is to put light into them, to put them into a network. And each year, we also select what we think are the most promising initiatives, what are the scalable initiatives, and we award them. We have a global allocation of 100,000 euro each year. And so far we had 34 winners. We've been following up and helping technically and financially. And each year we organize an international conference. It's also online in order to bring together all these people involved into e-health and disseminate knowledge, and also give more light on these local innovators, people in the countries who'll be able to bring these new services. Next slide, please. So from this database of 165 programs, active programs, we've tried to figure out what kind of, evidence-based information we could have, and which could be useful for all innovators or decision makers in that field. So we've looked at the fields of application. We looked at the healthcare themes, which the healthcare problem which have been addressed in priority, and also who were the operators. So next slide, please. Looking at the field of application, you see it's pretty well balanced between, targeting information, education, and communication for behavior change. A lot of initiatives are doing that, giving more information for the people in the field of prevention. So good health information for every population, even people who sometimes can't read. And also there is one important thing about also patient monitoring and medical data. And then another part is very much with health professional trainings. And let's say the fourth important proportion is with telemedicine, or let's say tele-expertise, being able to bridge the gap between the lack of specialists on low resource countries. And also we also have some initiative about financial care, micro-insurance, and also remote, and using also device which can also allow specialization consultations. Next slide, please. So looking at the healthcare priorities, there's no surprise. There is a huge number of initiatives which are targeting mother and child health, and also primary healthcare. And this is very much in line also with the Sustainable Development Goals. And of course, you have all the list also of health challenges which are addressed, but mainly, it's targeting mothers, children, primary healthcare for vulnerable people. Next slide, please. So who is doing what? In fact, there are three types of actors, and it's pretty well balanced as well. First, the non-profit sector. So it's NGOs, public authorities, local associations. The second type of actors is startups and enterprise, social enterprise. And the third one are healthcare professional and structures by themselves, so they could be private or public. And also there's a growing actor, which are also the academic entities, university, research laboratories, who want to study and want to implement some of the solutions. Next slide, please. So no surprise as well, what about the material which is used? It's mainly the phone, so mobile phone, half basic phone, half smartphones. Very often the smartphone is for the health professionals and the basic phones are for the beneficiaries, the patients. Next slide, please. So I would just like to give you a few examples of all these initiatives, and all the information is accessible through the website of the observatory. It's odes.iu. And regarding, maternal and child health, we have several really strong initiatives just to foster, the care of the mothers, to help her, attend the prenatal consultation, and which makes a huge difference with the quality then of the health of the mother. So I would like to stress in Cameroon, Gifting Mom, now 33,000 beneficiaries, 4,000 users per month. and they're linked with healthcare facilities. Always the link between healthcare facilities and patients is very important, is try to have the mothers do go and take care of themselves in health centers and give birth in health centers. You have also a few examples in Asia, in Nepal, in India as well, two very big initiatives. And for instance, in Nepal, it's through cartoons and sketches, they were able to give information to women who could barely read. Next slide, please. So what about all the health services which try to strengthen the health centers and also make it possible to capture the right data and to share the data with health authorities. And one example is really prominent. It's a real champion. It's YEDA. So it was implemented by the NGO Terre des Hommes in Burkina Faso. So there are more than 6 million beneficiaries now, 200,000 users per month. So it's the consultation for children in healthcare, in basic healthcare centers. And they're almost 70% of the primary healthcare centers which are included into this program, and 80% are using really the apps and giving the information, which is now shared with the government, with DHES too as well. So OPSMS in Ivory Coast is about immunization, and Afya Data is interesting. It's in Tanzania, and it's led by the Sokoine University, and it's one of a rare programs which addresses both animal and human health. Next slide, please. So how to also give access to diagnostic through connected device. So there are very good champions in that field too. I would like to quote Peak Vision, to screen, eye problems. And they've been screening 400,000 people in Kenya and Uganda, and so giving access to treatment and glasses. Africa Cardiac Care is in Cameroon, for ECG. Via Cardiopad, and in Guinea Epilepsy Project, it's more, let's say, a research program for epilepsy, which is also very important because epilepsy is really underdiagnosed and very much prejudiced against as well. Next slide, please. And the last example is about the healthcare professional training and tele-expertise. I would like to quote the Safe Delivery app. It's for midwives, and we have studied this application, especially in Ethiopia. It's been implemented, in 15 districts, in sometimes very remote health centers. The midwives, they don't have access to any training, and this is really a life-saving application. E-diabetes is providing 66 online courses on how to manage diabetes. And Teledamani is a program that we've been supporting for a long time now in Mali. And now it's just to give access to a diagnostic for dermatology. And let's say we're covering now almost 80% of the territory. And we've been training 104 health workers. Next slide, please. So what about the issue of upscaling? Because yes, we don't want to have only pilots. We want really a well-developed, large-scale program. And of course, technology is not a problem, as my fellow panelists told before. We need interoperability. We need cooperation between the players, and we need alignment with health priorities. Next slide, please. So the conditions for sustainable change, of course, as we said, it's institutional framework, private-public partnership, and also the role of the state and also universities, incubators, e-government. All this environment is very important. We also need, and I want to stress that, studies, medical economic impact studies. We don't have so much studies which prove, the impact of this digital on the health of people, and especially on, poor people. We also need, and this is something I would like to finish with and to stress, the development of training, including that of decision makers at government level, and of course, Dr. Adebola stressed that point too. And next slide, please. So I've got the opportunity just to tell you a few words about a program I'm very proud of. Is something we've built with the University of Science, Technique of Technology of Bamako. And it's a creation of an African inter-university diploma. So Bamako is the leader, but it's in cooperation with two other universities, the one Cheikh Anta Diop in Dakar and the University of Abidjan. And the idea is really to train, medical professionals, but also senior officials, let's say civil servants into the Ministry of Health and industrialists. And the organization is, there's one part by distant learning, around 100 hour courses. And then there's a hackathon. Everybody is grouped in Bamako for project learning and designing, collaborative projects. And the objective is really to try to contribute to a more harmonized development of interoperable and complementarity solution, and thus avoid fragmentation. And I thank you very much. Maybe you can have the last slide if you want to get some news about what we're doing. We are on the social networks, and you can contact us also on our website. Thank you very much. And I'm open for questions, of course.
Really, thank you. Great presentation, Beatrice. Thank you so much. Panelists, are there any questions from you? If not, or if you need some more time to think about a question, I have already one. If I might ask you, you presented some champions, how you called them, like LIDA, and also technology-driven champions like for eye disease screening. Now we learned from Jai in the previous presentation how important regulation can be sometimes. How much do you experience in your project that regulations or non-regulations are a boundary which are deciding about success or non-success of such projects?
Oh, regulation, it plays an important role. If you take the example of YEDA, YEDA has, in fact, gathered huge amount of data, of medical data. So a lot of the work has been to discuss the discussion between the NGO and the government of Burkina Faso. Because in fact, the NGO that started the project didn't want to keep this data. This data was really for public health and for the authorities. So it was very important that the regulation and also the technical frame allowed this data from the health centers to be, transferred into the frame of the, the health development system of the government, and they are using DHES2. So now the link has been made. So it's both technical, but it's also legal, because the government had to put the regulations. So there was a frame to use, to collect, use and store the data. And this is a really big issue especially in these countries. And as somebody said before, so a lot of government, they want the data to be to reside in the country, not in the cloud. So it is something also that we should take into account.
Thank you. Any further questions? If not, I would have a short, small one. You showed one slide about materials needed, and you listed phones, smartphones, computers, and so on, hardware. You did not list any software components. And then on the other side, you said technology is not the problem. So where are we in terms of software technology, in terms of digital health? Is that everything is just available, or?
No, you're right. I think, just like SatMed said, what they've done very smart is to put some of the, open source application which are proved, to be useful and well adapted as a free access. And I think Of course, we encourage, you know, this kind of solutions, you know, open source solution. And now there are also some champions in this open source solution. And I think one important thing to do is to be able to assess them and to be able to give access to the large number of actors to this solution. And also to help develop them, of course. And that's also where we need to sort of create a sort of network of scientists who could work together to increase the quality of this open source solution that can be shared, you know, with all the actors, with all the players.
Great, thank you. Thank you so much. And then it's a pleasure to come to the last session. Evelyn, do you want to take this?
Yes, sure, Titus. We have our last presenter for the panel discussion. Attendees, please stay hanging there with us for a little while more. You do not want to miss this last presentation. And it's my pleasure to introduce Dr. Melissa Andrews. She's a Digital Transformational Manager with Health Information Systems Program South Africa. And she'll be speaking to us from national e-health policies to multinational cross-border cooperation. I do believe, yes. Melissa, you are the last speaker for the day.
Perfect. Thank you so much. And thank you very much for your patience. Apologies for those technical glitches, but here we are. So firstly, I would like to thank all of you as our esteemed speakers and as well as our panelists and guests, and also to acknowledge Dr. Sean Broomhead, who was obviously supposed to be part of the session, but in his absence, just acknowledge his contributions to the presentation as well. Next, please. So our focus really for our topic is that we'd be splitting it into 3 questions that we are asking ourselves. What have we learned over the last decade? And from COVID, what would we need to do next? And what can we expect? So I'll highlight those throughout the presentation. Next, please. Specifically around the decade of working on national e-health strategies, we know it's not been an easy space. From our previous presenters as well, you've made that clear in relation to how we've moved forward. Sometimes we've kind of stumbled as well, but we have continued. And being sort of within the African continent, I think that has probably been one of our strengths as well, being extremely resilient in order to build up our healthcare systems. So we've got a good African proverb, Prof, if you can move to the next slide, which focuses on us, as us as a group and as a specific place holder. If you can move to the next slide, Prof. Pearls don't lie on the shore. If you want one, you must dive for it. And within that, we're really looking that each of us has brought a contextual aspect to this presentation, but also to our focus on e-health and really kind of getting to grips with what it is. And if we want to go deeper, we have to be brave enough. We actually have to collaborate a lot more and get to the grips of what it is. Next slide, please, Prof. And our focus really is that we're trying to get to a point where it doesn't matter what terms we're using, whether it's digital health, e-health, e-health, and we bring that to the fore because in some discussions and forums, these are still terms that kind of confuse us or throw us off a little, but we actually all are trying to say the same thing. Next slide. And focusing on that, we've already known that we've published in the last decade, we're probably, we're a year away from it, is the National E-Health Strategy and Toolkit. And this was the first collaboration between WHO and the International Telecommunications Union. And it was really this resource to almost allow us to know what it is we're working towards as a community and renewing our e-health strategies per country as well. Focused in 3 areas, a national e-health vision, a national e-health action plan, and then also a national e-health monitoring and evaluation plan. And just that framework that sets everything in place. Next slide. And our goal is health. All of us, every single one of us know that we are working towards universal health coverage. And to achieve this, we need to make sure that our health systems change. And digital health, like most of the presenters have already said, is our key enabler in achieving this change. So it's about how do we make it sustainable? How do we make sure that we're actually working together to bring about this digital health power that we are leaning towards? Next slide, Prof. And we know the health system has many challenges. There's this high burden of this disease, where there's this demand that exceeds supply, and we have concerns around the fact that our SDGs will not be met. So how do we move forward from there as well? Next. Digital health. We've established that it's recognized as the driver of transformation, and specifically for our African continent. So that's what we'd be working towards and establishing. Next. And we know that in 2016, it had become already increasingly clear that in order for us to achieve this universal health coverage, it wouldn't be possible without the support of e-health. So from a global community and a global perspective, we had already addressed that. Next slide. We also know that through this process in 2017, there was issues around sort of access being broadband, and it soon then will becoming the sort of social health determinant, or the social determinant of health, apologies. And many at the time looked at this and probably thought, oh, you know, how is this possible? But we don't question it anymore. We know that it is needed. Next. And the technology landscape is changing rapidly, and our risks are growing. That was shown by Stephen and our second last speaker as well, as to how we're seeing the technology being able to be implemented. But while it is being implemented, we have this band of risks that are just moving us and probably scaring us as well. Next. And some of those have been mentioned, but many are sort of uncertainty, the technical complexity, our high costs, the diverse stakeholder groups. You know, you've got so many people all within the space. How do we actually make sure that we are aligning ourselves? How do we make sure that we are speaking the same language and moving to sort of forward into this e-health space? And really this competition for resources as well. If we're not thinking of training, maybe we have people who are trained within the public health sector, but they are then kind of called upon within the private health sector. So we're completely losing our resources sometimes, and our human resources as well. Next. So what do we need? We need good national strategies. And as many of our speakers have said already, we have many African countries who are sort of focused on good national strategies. They have many in place already. Some of them are probably within their first round, but there are a few of them who have gone on to their second round as well. So those are just a few of them. It's not a, you know, a complete list of all the countries, but it's good that I know that one of our speakers from Kenya said that you're also focusing on possibly then your second round of national strategy as well. Next. Everything in strategy is very simple, but that does not mean everything is very easy. And that's what we need to also highlight very clearly, that we've put all of these strategies in place, but now it comes to our implementation. And how are we going to get through that implementation? Many of you have highlighted already what some of the issues are through that implementation process. So it's about how we move past those. Next. Just some of our lessons from COVID, which are extremely important then. And our next slide and the next two slides will really focus on the 5 e-health strategy areas then. So if we can go next, we're really looking at the leadership and governance, our services and application, which are 2 of the 5 focused areas. I'll pull out some. The common challenge can encourage stakeholders with disparate interests to communicate. We know that we needed clear decision-making, and clear decision-making sort of processes save time. We needed cross-functional data teams that collaborate with external partners. Some of our services, we know that we have learned that information systems already known to users roll out faster, and they also then, at times, even if they are imperfect, they just get to be used a lot quicker. Yes.
Hello, Evelyn, Miss Evelyn? Miss Evelyn Akelo?
Yes, please.
Yes, please. I am begging that we try to wind up because we are past time.
We are finishing in 4 minutes. Thank you.
Yeah, we will be wrapping up in 4 minutes, Samuel.
Okay. Please let it be 4 minutes because we are very much.
Thank you.
Will do. We can move on to the next slide.
Melissa, I would ask you then to wrap up in the next 1 minute so that people have an opportunity to ask you 1 or 2 questions.
Perfect, I'm with you. And then I think it's important to mention that we do know standards and interoperability are important because allowing us to manage a pandemic needs a lot of data from different sources. And as many have said, interoperability is what we need, and that would be one of the drivers to save lives. Our next slide, we also looked at sort of what we can do next and what those actual implementations would really be. At HIS, we believe in building better lives together. Our next slide, and just to bring out some of those issues, and this I think could be our last, maybe a next, really look at how we move to needing more data. We need a person-centered design for person-centered care, more collaboration, but also more importantly, more leadership. We need more emergent strategies that are flexible enough to take advantage of this rapidly changing space, our rapidly changing technology, and we need to invest frameworks that help us to select these optimal initiatives. Just one more slide.
That's a beautiful point to flag out.
Perfect. Thank you. Thank you so much.
Great for you to stop. And I would like to request that we ask Melissa maybe 1 or 2 short questions so that we can quickly wrap up. We just have.
Thank you very much, Evelyn.
Thank you, Melissa. Do we have any questions for her?
I would have 1 question, but if there's anybody else, please move ahead. Then I'm putting myself back.
I don't see any, so please go ahead, Titus.
Yeah.
We have a short question for her.
It's a question to Melissa and it's a question to all panelists, actually, both. So when I would have asked you about 5 and or 10 years ago, where would we stand with digital health in the year 2029? Did we succeed? Are we too slow? Did we meet our expectations? Maybe you can rate that, because obviously it's a very difficult terrain, and I'm wondering about your judgment here.
Yeah, thank you, Prof. I think also, I mean, we know that we've been slow sometimes, slow to action, slow to collaborate, slow to really understand maybe the ecosystem. So maybe we should have been a lot further than we are right now. But I think many countries have done the best that they could do with the capabilities they do have, with the resources they do have. So we have to be mindful about that. I think with forums like this, we kind of understand more than as to possibly where our weaknesses have been and where our lack of collaboration has been. But I would suppose that as we move forward, we would be gaining a lot more ground. I think COVID has really forced us to look at ways to be more sustainable, collaborate more, look at different ways of implementation, and really bring across the strengthening of our governance. That possibly has been some of the things that have been lacking and kind of holding us back. You know, if everybody's doing what they want to be doing for their own country, it does slow us down then to reach kind of this global understanding of where we want to be. So I'll leave it at that. Maybe Jay wants to add to that as well.
No, I think we don't have time for Jay to add to that. Thank you very much. I want to take this opportunity to thank all the panelists and speakers for great presentations, great discussions. But I also want to thank the attendees for hanging in there. We are overshot by about 25 minutes and you're still online. Thank you very, very much. And a great thank you to my co-chair, Professor Titus, for chairing this great session. I think we had a very, very interesting discussion with very great panelists. And I want to hand it back to you to do the wrap up of the session. Thank you very, very much, everybody. And I hope you enjoy the rest of the study. Professor Titus.
Yeah, thank you, Evelyn. I think because of the shortness of time, there's not a lot of things I can add. I think we have had a very diverse session, from practical on-the-ground work to theory and concerning health politics. And it's a pity, of course, that we couldn't meet, but I think we have done a good job in this 2 past hours. And I hope that the audience is sharing this view. And I wish that we see us healthy again back soon somewhere, sometime. And thank you very much. And I wish you all to have a great day. Thank you.
Thank you.
Thank you very much.
Thank you. Thank you very much.
Thank you. Thank you.
Buddy.
Bye-bye.
Bye-bye.
Goodbye.
Bye, everyone. Thank you.
Thank you. Over to you, Samuel.
Ciao.
With the session.
Okay, please. Thank you so much, everyone. Thank you for making the session happen.
Thank you, Samuel, for
Thank you. Bye-bye.
handling the IT section of the session. Thank you very much. We appreciate.
You're welcome. You're welcome.